The gloves must be intact with no holes or tears. Replace any damaged gloves immediately. If you need to replace a glove during a procedure, use an alcohol-based hand rub before putting on the clean gloves. Gloves must fit properly. If the gloves are too tight, they will be uncomfortable and may stretch, decreasing the effectiveness of the barrier. If the gloves are too loose, they may slip from your hands. Gloves are most commonly made of latex. But if you have, or the person you are caring for has, a latex allergy or sensitivity, use approved gloves made of another material. Remember that protecting yourself from pathogens is only one step toward breaking the chain of infection. When your gloves contact a pathogen, when you've touched another person, for example, or any body fluid or substance, the outside of the gloves becomes contaminated and the gloves must be removed before touching any other surface or person. Otherwise, they could transmit pathogens to whatever you touch next. Here are the steps to safely remove your gloves. With one gloved hand, grab the other glove at the palm and pull the glove off your hand. Using your ungloved hand, slip 2 fingers underneath the cuff of the remaining glove. Remove that glove, turning it inside out as you pull it off. Dispose of the soiled gloves in an approved container. Then, wash your hands or use an alcohol-based hand rub according to your institution's policy. Gowns are called for when there is the possibility that your uniform may become soiled with body fluids or substances. Using a gown as a barrier prevents your clothing from being contaminated. The gown is considered contaminated if it becomes wet or soiled. Paper gowns, by far the most common type in use today, are disposed of after one use. Fabric gowns, if used at the facility where you work, must be laundered after each use. Let's look at the proper way to put on and take off a gown. To put on a gown, if you're wearing a watch, remove it and place it in your pocket or on a clean paper towel. If necessary, push up your sleeves so that they're 4 or 5 inches above your wrists. Perform hand hygiene. Gather your needed supplies, which are a gown and gloves. Put the gown on by slipping your arms into its sleeves. Secure the gown around your neck by tying its ties into a simple bow or by fastening its Velcro fastener. Reach behind you and overlap the gown's edges so that your clothes are completely covered. Secure the gown at your waist by tying the ties in a simple bow or by fastening the Velcro. Put on the gloves so that the cuffs of the gloves extend over the cuffs of the gown. To remove a gown, remove and dispose of your gloves. If the gown ties are in the front, untie the waist before removing your gloves. Loosen the waist by untying the ties or unfastening the Velcro. Unfasten the neck. Be careful not to touch your neck or the outside of the gown. Grasp the gown at the neck fasteners and pull it loose and down over your shoulders. Be careful to touch only the inside of the gown and pull it away from your body and off your arms. Hold the gown away from your body. Roll it downward, turning it inside out as you go. Take care to touch only the clean side of the gown, what used to be the inside when you were wearing it. After the gown is rolled up, with its contaminated side on the inside, dispose of it in an approved container. Finish by performing hand hygiene. Masks are worn when caring for a person who has an infection that can be transmitted through the respiratory tract, and are worn any time there is the possibility that blood or body fluids may splash or spray towards your face. Masks work to protect the mucous membranes in your mouth and nose from becoming contaminated. There are many different types of masks that are worn, depending on the task to be performed and personal preference. Many types of masks have attached eye protection shields and serve to protect the eyes as well as the nose and mouth. To put on a mask, gather your supplies, which in this case is a mask. Perform hand hygiene. Place the mask over your nose and mouth, being careful not to touch your face with your hands. tie the top strings of the mask securely behind your head. Tie the bottom strings of the mask securely behind your neck. Make sure the mask fits snugly against your face so that you breathe through it, not around it. To remove a mask, untie the bottom strings first, and then untie the top strings. Hold onto the top strings and remove the mask. Then, holding the mask by the ties only, dispose of it in an approved container. Perform hand hygiene. Protecting your eyes as a portal of entry is very important when there is the potential for body fluids to splash. If you're working with anything that might splash, you'll need protective eyewear such as goggles, face shields, and other devices to protect your eyes. Blood and body fluids, even the fluid used to irrigate wounds, can splash and transmit pathogens into your eyes, a portal of entry. When removing protective eyewear, remember that the front may be contaminated, so only touch the eyewear by the side arms when removing. The fourth type of infection control, after medical asepsis, surgical asepsis, and barrier methods, is standard precautions. Because pathogens such as the hepatitis virus or HIV can reside virtually undetected in a person's blood, and because infected blood or other body substances can leave the body through any number of exit portals, you must treat every patient or resident you come in contact with as if he or she might be infected with a blood-borne pathogen. To do this, you'll employ standard precautions, which are precautions against blood-borne pathogens that must be taken with every patient or resident. Standard precautions include the use of personal protective equipment, as demonstrated previously, and which includes masks, gowns, protective eyewear, and gloves. The proper disposal of sharps, such as used needles, razors, or broken glass, in OSHA-approved containers. Note that contaminated broken glass items should not be handled, even with gloved hands. Instead, the glass should be swept up and disposed of in an appropriate waste container. Standard precautions also include the cleanup of spills of blood and other body fluids in an approved manner. Spills of blood or other body fluids must be cleaned up with an approved cleaning agent or a solution of 1 part household bleach to 10 parts water. Wear personal protective equipment while cleaning up spills. And standard precautions include hand washing. In order for standard precautions to be effective, they must be used consistently. They must become your standard of professionalism. Transmission-based precautions are used in addition to standard precautions when a person is suspected to have a disease that is transmitted a certain way. For example, via the air, in droplets, or by direct contact. Transmission-based precautions are used along with special environmental controls, such as ventilation systems, liquid waste disposal methods, and procedures for handling contaminated linens or trash to prevent the spread of infection throughout the facility. Any of the 3 types of transmission-based precautions can be used in combination with the others. Equipment that you use during routine patient and resident care should be disposable when possible, kept in that person's room, and not used for other patients or residents. Airborne precautions are used when caring for people infected with pathogens that remain infectious when suspended in air. When an infected person coughs or sneezes, the pathogens leave the body through particles of saliva or sputum. As these particles spray through the air, they dry out and remain in the air for a long time. Like dust, the dried out droplets containing pathogens are in the air we breathe and on surfaces we touch. Infections that are transmitted by airborne particles that are then breathed in include measles, chickenpox, tuberculosis, smallpox, and possibly SARS. Airborne precautions include placing the person in a private room called an airborne infection isolation room that is equipped with special ventilation and filtration systems. Healthcare workers caring for a person on airborne precautions should wear a mask or high filtration respirator that is donned before entering the room. Gloves should also be worn when touching the person or items that may have come in contact with the person's saliva or sputum. Healthcare workers should also wear a gown when changing linens or providing care which would cause their uniforms to be against the bed linens or the person's body. And when the person leaves the room, she is required to wear a mask also. Droplet precautions are necessary when caring for people who have diseases caused by pathogens that are transmitted by direct exposure to droplets released from the mouth or nose. For example, when the person coughs, sneezes, or talks. Infections that are transmitted by droplets include mumps, influenza, whooping cough, strep throat, scarlet fever, rubella, meningitis, pneumonia, diphtheria, and epiglottitis. Droplet precautions are the same as airborne precautions, except that with droplet precautions, it is usually necessary to wear a mask only when you are within 3 feet of the infected person. Masks and gloves should be worn when performing procedures that involve contact with the infected person's mouth or nose, or when touching or handling items that may have come in contact with the person's sputum or saliva. Contact precautions are used when caring for people with diseases caused by pathogens that are transmitted directly, by touching the person, for example, or indirectly by touching fomites. For example, contact precautions are taken with patients or residents with skin and wound infections, digestive tract infections, some types of respiratory tract infections, and head lice or scabies infestation. Contact precautions involve using barrier methods whenever you must touch the infected person or items contaminated with wound drainage or body substances. Disposable items are used whenever possible, and items such as trash and laundry may be removed from the room only after double bagging. Patients or residents requiring transmission-based precautions may have to be kept in a private room with the door closed. They may not be allowed to leave their rooms unless it is absolutely necessary to do so, and the people caring for them must wear PPE. When caring for a person with a communicable disease, it is sometimes easy to forget that we are caring for a person with feelings, and that we risk making that person feel dirty or unwanted. Imagine how you would feel if healthcare workers had to wear gloves or a mask every time they came near you. When caring for a person with a communicable disease, your first responsibility is to help prevent the spread of infection to other patients or residents, to visitors, and to yourself and your family. But at the same time, you can also make the patients or residents under your care feel less isolated and less lonely by checking on them frequently, taking the time to talk to them, and remembering to treat them as people with pride and self-respect. In other words, as human beings.